Hey y'all, I'm Serena Ahmed Arroyo with Blue Action Texas. This series is called Just the Facts, and today's episode is on how we can take action to address the Texas healthcare crisis. Medicaid expansion is only one of many things Texas needs to do to fix this crisis. But sadly, MAGA Republican leaders in Texas, like Governor Abbott, have made it clear. They care less about the facts on expanding Medicaid and more about politics. Let's talk about it. Here's what we're going to cover today: how Texas compares to other states' healthcare systems, what is Medicaid expansion and why it is important, and last but certainly not least, what we need to do to take action. Consistently, Texas is ranked as one of the worst states for healthcare, from access to doctors and affordability to preventative treatments, as well as metrics on health outcomes, including premature deaths. By far, the highest percentage and number of uninsured individuals in the entire country are in Texas. If you are looking at this chart, you will see how Texas is not only at the very bottom, but is even way worse than the next to last state, which is Oklahoma. This is a crisis, and the representatives we have elected to state Congress can address this by passing Medicaid legislation. So, what is Medicaid? Medicaid was established in 1965 along with Medicare. While Medicare primarily covers seniors over age 65, Medicaid is a joint federal state program providing healthcare coverage to low income individuals and families in the United States. There are around 80 million people enrolled in Medicaid, and 37% are children. Without Medicaid, they would not have health insurance. Research demonstrates that having health insurance is essential to positive health outcomes. People with access to health insurance are more likely to see doctors for preventative care, allowing them to receive critical and even life-saving treatments before it becomes an emergency. Access to health insurance also reduces the risk of bankruptcies due to medical bills. In 2012, the Affordable Care Act, otherwise known as the ACA or Obamacare, expanded Medicaid coverage for millions of hardworking, low-income Americans who are still otherwise ineligible for the program. A decade later, the number of uninsured people dropped by 42% in the US, but Texas still has the highest uninsured rate in the country and has not benefited like in other states. Why is that? Well, states retain the choice to expand Medicaid or not. When a state expands Medicaid, the federal government pays for 90% of the cost. If a state does not expand Medicaid, the state only receives the standard Medicaid federal funding, which would be 60% of Medicaid costs. By early 2025, 40 states have opted in and passed legislation to expand Medicaid and receive the additional funds for its citizens. Thanks to Governor Abbott, Texas is one of the handful of states that have not opted to expand Medicaid, forfeiting those much needed federal dollars. So Texans are paying more and getting less. Let's talk about the 4 key reasons for why the Texas state legislature should pass bipartisan legislation to expand Medicaid. First, it will give more Texans access to health care. Expanding Medicaid would provide health insurance coverage to over 1 million more Texans. Some people mistakenly believe that it's non-citizens who would benefit from this. That isn't true. It's low-income working families and children, families who make too much to qualify for subsidized private insurance or to meet the current Medicaid eligibility poverty thresholds, and now are uninsured. Over 10% of children in Texas don't have health insurance, which means they often don't get the care they need, and we can fix that. Second, it will help to make Texans healthier. Right now, Texas consistently ranks in the bottom 10 states for health outcomes. Passing Medicaid expansion legislation is a common sense opportunity that saves lives. Studies have found that states which expanded Medicaid resulted in lower mortality rates, including maternal and infant deaths. Sadly, Texas also leads the nation in one of the highest maternal mortality rates. The vast majority of these deaths are preventable. Third, it will help to build our economy in Texas. Expanding Medicaid would add billions of dollars to our GDP, grow state revenue, add hundreds of thousands of jobs, and increase personal incomes. A healthier workforce helps Texas businesses succeed. The states that have opted in to expand Medicaid are reaping the economic benefits, but not Texas, due to the Republican Party's leadership, or more correctly said, their lack of leadership. The fourth key reason to support Medicaid expansion: This especially helps rural Texans. Hospital closures are occurring more in rural Texas than anywhere else in the country. Rural Texans have higher rates of uninsured families, less access to doctors due to the rising physician shortages, and worse health outcomes than their urban counterparts. Other states that have expanded Medicaid have fewer hospital closures. According to a recent survey, 69% of Texans support expanding Medicaid. Texans want this legislation passed. Medicaid expansion gives more people healthcare access, makes us healthier, builds our economy, and helps our rural communities. So, how do we take action? Call your representatives and voice your support for passing Medicaid expansion. The bills this year are SB 232 and HB 895. Next, sign up for a Blue Action training to become part of the movement that can oust Governor Abbott and other MAGA Republicans out of office. They are on our ballots next year, but the work to make this happen starts now. For more information, sources, and action steps, visit www.texasblueaction.com/justthefacts.